Hello, welcome to Let's Talk Climate. I'm Ben Valencio Turner, the Director of Climate for Health at ecoAmerica. I'm joined today by our Climate for Health Fellow, Dr. Bruce Bakar, and two fantastic guests from Kaiser Permanente. First, we have Seema Wadhwa, the Executive Director of Environmental Stewardship at Kaiser Permanente, and we have Dr. Colin Cave, Medical Director of External Affairs, Government Relations, and Community Health with Northwest Permanente. Thank you so much for being here today.
Thank you so much for having us. I'm so thrilled to be working with you guys and support all the things that you guys are doing to really help make the planet healthier.
I agree. It's an honor to be here on your podcast today. There's lots of ways to make a difference, and I appreciate that we're able to share what we do and to learn from you as well.
Great, thank you. So we'll start things off with a question for Colin. So you're in the Pacific Northwest, and we've seen climate impacts grow more and more over the last few years and be pretty dire in your neck of the woods. Could you share how this has been affecting patients, how it's been affecting care?
Absolutely. I think one of the first things to understand in medicine is that we as doctors do very little for most people's overall health. 80% of a person's health is predicated on what happens outside of the exam room. So when we take that to heart in the Northwest, just looking at the last 2 years, in 2020, worst fire season ever in the Pacific Northwest, and in Oregon, over 1 million acres were burned. Now, when we talk about our patients, we're basically talking about the community as a whole and the people that are not just members of Kaiser Permanente, but also in our communities, because anybody can show up in any ER, and it's our obligation as physicians and clinicians to care for our community. Air quality was over 600 at that point with those fires going on. 4 small towns were completely obliterated by fire in Oregon. Thousands of homes were destroyed. 40,000 people were evacuated, and 500,000 people were in evacuation zones. Now, when you look at what that means, just the upheaval and the loss of a place to call home in the middle of the beginning of COVID, these people had to go somewhere. And most of these towns don't have a lot of money. So they would end up going to community shelters where we didn't have any vaccinations against COVID. You're putting a whole bunch of people that were not able to shelter at home in a unified space. So it's a double whammy, if you will. They lose their homes, and now they're even more susceptible to getting COVID. So those with less money or no money were oftentimes going to be facing poor health. Mental health issues started to shoot through the roof. Again, just stacking all of these things. You lose your job. If your business burns down, you can't work, you lose your money. Now you're living in a large area with a bunch of people. We also know that emergency room and admissions go up. Emergency room visits and admissions go up anywhere from 5 to 25% every time we have a fire in the Pacific Northwest because of 2.5 micron particles, cardiovascular disease, how the inflammation affects our patients. And then you fast forward a year later, last year, after the big fire season from the year before, we have a heat dome that hits the Pacific Northwest. Unprecedented heat, 116 degrees in Portland, Oregon. We're known for our rain and our trees. 116 degrees, and those temperatures were close to that for a good 4 to 5 days because of that heat dome. By the way, pressure cookers are based on the technology that we see in a heat dome environment. Over 1,000 people died in Oregon, Washington, and British Columbia. 1,000, more than 100 in Oregon, more than 100 in Washington. We had 1,100 hospitalizations in Oregon and Washington during that period of time. And you ask how it affects our patients. Well, you got a patient with other issues, they can't make it to the hospital. 911 and EMS is being called out to different areas. So it directly affects not just those affected by the heat, but also those that aren't affected by the heat that have other medical problems. Crops died on the vine. Workers out in the fields in Washington, 40% of workers had no access to shade, and 25% had no access to cold water. There was a death of an outdoor worker in Oregon. It's just awful in the Northwest. And this doesn't even count the toxic algae blooms that we had several years before, where people in Salem had to have bottled water for 10 days. So I think that's a good summary. It's getting bad.
Yeah. And I think that it's really important how you noted that these impacts stack up on each other and on the existing social inequities, that this is hurting the communities that are historically marginalized the most. and that heat, air quality, all stack on top of each other and have those direct kind of physiological and social impacts on folks. And I imagine on top of the pandemic, obviously, it's been tough on the healthcare providers doing the work, serving patients throughout the pandemic, and then on top of it, these climate crises that are hitting the region.
Yeah, it's important to remember that our physicians and administrative staff, they're all exposed to the same heat, fires, and evacuations as everyone else. I mean, evacuating a hospital is stressful. A lot of our staff had to pack up their cars and be ready to go on a moment's notice while they were still caring for patients in the hospital. We had learned from Santa Rosa Kaiser. They had to evacuate their hospital twice in the past several years, and physicians and clinicians and nurses around them had their houses burned down. So these are very fresh in our mind when that happened. Pandemic fills our hospitals. It does bring people together in kind of a foxhole environment, but it is stressful. And especially if you know one of your colleagues who got sick while caring for others in the same environment that you're in. Lost workers, both from retirement or just being fed up with it, or becoming sick or dying, overfilled hospitals, physicians, clinicians, nurses, all being afraid for their life at the beginning of this pandemic. Then there's again, we talked about mental health for the patients that lose their houses. It's true for the healthcare providers as well. Yes, it's a conglomeration of everything that the healthcare community has had to face, in addition to everything else that our patients have had to face. It's been an up and down, roller coaster for us. So thank you for asking.
Colin, that's incredible. And I really want to thank you for giving us such a broad understanding. And as Ben was saying, it's so important for us to understand, even those of us in healthcare that aren't right in the middle of these crises, what a huge stress it is for providers at all levels throughout the system. And that's amplified by the way that patients react towards the people that are providing that care. So I think I speak for everybody here as well as everybody watching. I want to acknowledge you for your bravery and perseverance, for all the people up there who are fighting the good fight and taking care of people and putting their own needs second, third, and fourth in the midst of just an overwhelming amount of stress. So anyway, I sincerely mean that. Thank you for all of your work during the pandemic and for continuing to provide care despite all the strains at multiple levels. But I want to pivot and sort of pull back to talking about climate and health and Kaiser's position in this. I have more than an abiding interest in this topic. I was a Kaiser Permanente physician in the OB department in San Diego for 24 years. I've always been very proud of Kaiser's stand in terms of facilities and buildings and processes to lower the impact and set a high bar for the rest of the medical community throughout the country, and showing leadership there. But now we have Seema Wadhwa in the position of environmental stewardship, and her leadership is starting to take off in the direction of getting providers, doctors and nurses, as if we all don't have enough to do, and to think about getting us involved in stopping the climate crisis, which, as you so correctly pointed out, affects us all and affects the burden that we face in taking care of patients. So, Seema, can you say a bit about what you've been able to affect in your time at Kaiser, and what might be coming down the pike?
Yes, absolutely. And I think before getting into the what, I do just want to follow along with Colin in terms of the why. And a lot of the why is to deal with a lot of the things upstream that Colin mentioned, but to deal with it in a way that we have a unique power to manage. So I'm very fortunate coming into Kaiser Permanente, being an organization that recognizes how important climate change is to the health of our communities and how it really is a force multiplier. And in terms of how we're approaching this existential crisis, there are really three key pillars of work that we're trying to make a difference on. The first one is really focused on our own operations. What are we doing to manage our own footprint and to be a responsible member of our community and to really align with the oath to do no harm? So that includes managing our energy, our water, our waste. How are we working in a way that isn't contributing to the challenges that our communities are facing? The second one is really focused on looking upstream in our communities in terms of investments we can make so that there aren't downstream health impacts through that lens of environmental stewardship. And that really happens in two different ways. One of them is really, direct support to the community, but also we realize that we have an opportunity and, an unparalleled voice to shift the narrative when it comes to climate change. And we know that physicians and clinicians especially have a disproportional opportunity to drive that change. As we all know on this call, the image of climate change, even today, if you look up the image, it's still polar bears and it's still ice caps. And, I think if there's one thing that we can do is unfortunately change that mental image to be one of a child dealing with asthma, because that's the reality of climate change. That really leads to their third pillar. And that third pillar is about, leading and engaging and catalyzing change. And that includes work around policy and advocacy. That includes engaging stakeholders. That's also being thoughtful of building coalitions and joining collaboratively with others, because we know the scale of this challenge is not one that we are going to be able to solve independently. This is something that we need to work together, not only as a healthcare industry, not only as a country, but truly as an entire world to drive to protect the health of all of our communities. So those are some of the things that we're working on to try to make a difference and try to make Colin's job not quite as challenging.
And you so rightly point out that Kaiser is in such a position, being the national organization with the wonderful reputation it enjoys, of being able to make a real difference in how this conversation evolves. And as we've been saying, my colleague, Dr. Dina Kola and I, that we shouldn't talk about polar bears as much as we talk about pregnant bellies, as well as children with asthma, elderly people having heat stroke. It really is an issue that it invites the connection between climate change and health. So is there anything you can tell us in terms of the specifics of what Kaiser Permanente is moving into as it seeks to expand its influence in this crisis that we're working to overcome?
Yeah, so absolutely happy to highlight some specifics. I'm going to start a little bit large scale, and then I'd love to highlight some things that we've been doing with the Climate for Health program. So, on a national scale, we have helped support work through the National Academy of Medicine, their action collaborative on climate change, and that really is focused on elevating the work of the healthcare industry and elevating and accelerating that work. And part of what we do is also supporting other organizations such as Healthcare Without Harm in driving change. But to bring that to more of a tactical level of, what are we doing within our own organization to drive some of that change? We've been very excited to roll out in our Northern California region. Most recently, we did a Climate for Health ambassador training where we had almost 100 team members from that region invest multiple hours to really learn about the issues, how it connects to health, and how they might be able to leverage their voice when it comes to climate action. And that's something we look forward to supporting education even further down the road. And, as we move forward, we appreciate a variety of resources and tools that have been developed by the Climate for Health program and ecoAmerica to really help us accelerate and scale what we're able to share through the work that physicians are doing and clinicians are doing. So, looking ahead in changing that narrative, we really recognize the importance of the clinician voice as a powerful voice to move things forward.
And there's historical precedents for this too. The Clean Air Act, I'm sure we all recall, those of us that are old enough to have been around then, was primarily passed at the federal level as a health bill. And so we are tackling an even bigger crisis. And I really do think, as you're saying, that the opportunity is there for healthcare workers to be at the very front of that conversation and to really move us into the scale of action that we need. So that's really exciting, exceptional leadership. Thank you for what you're doing, Seema.
Thank you guys for what you guys are doing.
And Colin, coming back to you, what have you been able to do in Northwest Permanente as far as acting on climate change?
Well, Northwest Permanente was actually the first medical group in the world to become a certified B Corporation, something we're very proud of back in 2016. And straight out of the gate, we focused on environmental leadership. We realize as a medical group that people can't be healthy if the planet that we're living in isn't healthy. And so as we became a B Corp and looked for how we can make an impact, we first started looking at our own emissions way back in 2017, before a lot of groups even knew what they were. And we actually purchased some of our first offsets at that time. And then every year since then, we've either done one or two important things to keep ourselves moving along. In 2018, we developed our first community partnership with Forest Park Conservancy. It's the largest forest within the borders of an actual city in the United States. And we were able to provide volunteer time, teach our physicians about the paths that are available so that they could actually get out and get some, back to nature stuff that they could then share with their patients. We learned a lot from that organization as we move forward. In 2019, the first major medical group in the country to put forward a climate action plan. In 2020, we created our first intranet environmental website, and with our subject matter experts, even in the middle of COVID, put together an extensive corporate environmental guidelines that helps to guide our group, both to help mitigate our emissions and what we put out, but also to make sure that we are prepared to provide our services to our patients in a climate changed world. It's a both and, not an either or, as far as we're concerned. In 2021, we published the first of its kind large paper on virtual visits that we had a lot of experience with dating back to 2015 and then up to and including COVID, and how virtual visits significantly decrease the emissions that are put out into the environment of the Pacific Northwest. Our goal and our aim and our promise is to be carbon neutral by 2025 as a medical group and net zero by 2030. And we're very excited to work with Seema and our health plan colleagues to achieve Kaiser Permanente nationally, becoming net zero by 2050, reducing our emissions by 50% in 2030, and very proud of the fact that Kaiser Permanente is the first large medical organization in the country to become carbon neutral. So lots of stuff going on, both within our medical group and with the opportunity to team up with Seema. It's a very exciting time.
That's all incredible. And I do want to point out something that maybe gets overlooked sometimes when we talk about this issue. Initially, when you were talking, you talked about a lot of strain on the providers and just the burden on the healthcare system that the climate crisis presents. As you get more and more of your Northwest Permanente partners involved in this work, what do you hear back from them as they engage with this? Is it, oh, this is one more thing I got to do, or does it have any kind of a positive impact on them?
Well, I think with anything, there are people at both ends of the spectrum. But the great majority of the physicians and clinicians, the administrative staff that work at Northwest Permanente are eager to figure out how we can educate people. And time just seems to be the biggest challenge, being able to explain to people why it matters. And so I know there's a lot of select conversations going on with parents who have children that have asthma, or our patients that are members that work outdoors in heavy smoke environments. So our physicians and clinicians, I mean, I'm just so fortunate to work with such a group of caring individuals. They want to do what's right. So when we start talking about climate change, getting information to our physicians to get to the patients, most are like, give it to me now so I can implement it.
I think that's just so inspirational, just both to hear about the individual clinicians, seeing part of their duty, part of their responsibility of providing care, being engaging about climate change, giving people resources to deal with the immediate reality, and also to be part of the long-term solutions, whether that's kind of through their institutional work or as individuals. Is just thank you both for both joining us today and for all the work you're doing within Kaiser and with patients to move this forward. I'll give you one more chance for either Seema or Colin to share anything else that you'd like to present to the group.
Colin, I'm putting you on the spot here, but, oftentimes a lot of the what can this look like gets very theoretical and not tactical. And I wonder if you might share a little bit of the work that was done this last season in terms of trying to connect our community with resources such as, air conditioners during the most recent heat wave. That might be something that others can take as, here's an example tactically of what action looks like.
Yeah, I appreciate that. And so in the Northwest, when we have the heat waves, we've achieved some waivers with Medicaid and working with what we call our CCOs, organizations that take care of a lot of patients that have Medicaid, for instance. A lot of these marginalized individuals, marginalized populations don't have a lot of resources. And so when the heat comes and affects them, again, we talked about 2 years ago, the heat dome, 100 people in Oregon died from the heat, and the great majority of those people were found dead in homes without air conditioning. So understanding what happens to a person's health in these pretty unprecedented times, lots of measures have gone forward now to actually realize that keeping a house clean, cool, and people in housing does help provide and improve the health of those individuals and their families. And so I think it's turned upside down what health is defined as. At the beginning of this talk, we talked about, only really 20% of health occurs in the doctor's office or the clinician's office. 80% is outside. But as Seema alluded to, we've learned how to help people outside of our offices and through our community health, community benefits, waivers with Medicaid, understanding now what the social determinants are and how not only is it important to understand the social determinants in quote unquote normal times, but how these are exacerbated in these unprecedented climate change times. We're able then to make an impact outside of our exam rooms and into the homes of these individuals. Providing air conditioners for hundreds of people in Oregon is just one example of what that looks like. And there are many more, but we just don't have time to talk about them today.
No, I've seen the press on the Medicaid is covering in Oregon some climate related expenses, and anytime you can harness the power of the healthcare finance beast to drive forward and address some of those social determinants of health, whether it's food, outdoor access to green spaces outdoors, or a comfortable, survivable living condition when you sleep overnight. That's really it's a really powerful tool to address those health impacts and help prevent a lot of harm. Seema, did you have anything else to add, or Colin, before we sign off?
Just a note of gratitude for elevating and committing to raising the issue and for having us join this important conversation. So thank you.
And I would say that, I think probably one of the things that people are hesitant about jumping into this is for those that don't know a lot about the environment or the health effects, but maybe they know the environmental issues and other aspects. It's sometimes daunting feeling like you have to reinvent the wheel, take it upon yourself. create these things to share. And that's not true. We don't have to reinvent the wheel. You all have done a great job of inventing the wheel. And I would encourage the listeners to check out your website. I have done it myself. The information that's available that you share is right on. So thank you for the work you're doing. Thank you for making it easier for those of us that want to use your services and share with others.
Thank you. And we're so happy with this partnership. We're so excited about how we can grow, how we get the huge reach of Kaiser and the leadership role that Kaiser Permanente has nationally, and how we can help an even greater acceleration of that leadership on climate to have an impact and save folks' lives. So that'll conclude our time today. But thank everyone for joining us, and anyone listening, please engage with us online with the hashtag Let's Talk Climate, and be sure to subscribe and follow us for the latest thought leadership, resources, and episodes on climate action and advocacy. From everyone here at ecoAmerica and Climate for Health, thank you for being here, and please stay safe and take action.